Hi guys, my name is Alexis and welcome back to my channel. So in this video, I'm going to be talking about Camila recovering from her first heart surgery that she had. And I wanted to go over Camila's heart surgery as well. Camila had a pulmonary artery band. And what that is really just a band on the pulmonary artery from the heart, takes blood from the heart to the lungs to get oxygen. Camila got a band on her pulmonary artery to restrict the amount of fluid going into her lungs, and it was causing her to breathe really rapidly. And it was kind of more of just I think of it as like a band-aid fix to allow her to grow before we had to do a bigger, more complicated surgery that was possibly going to be corrective surgery. So that first day, May 12th, once we see Camila and we're able to hang out with her and just be with her, was a very hard day. Part of Camila's pain management was to be sedated, at least mildly sedated for most of the day. She was like very halfway there. I mean, she was 2 weeks old, 18 days old, and I'm trying to get her attention and just trying to hold her and just let her know like we're there, but she's really like barely moving, barely opening her eyes. And the doctors are continuously sedating her a little bit just to kind of get her out of it as part of her pain management from her surgery. Another kind of pain medication Camila was on that they tried was fentanyl. And Camila did not react very well to that. After a few seconds after taking that medication, her oxygen levels would just drop really drastically. And they were dropping to like 40s, 50s maybe, but that was just very dangerous. They did try it a few times because it could be that it wasn't working well with anesthesia. It could be that it was just too much at once. Camila's a tiny little baby. It's a very strong medication for such a small little baby. So they did try it a few times, but every single time the oxygen levels just dropped. So they just said, you know what, Camila does not react well to that medication. She might be allergic to it. Let's just try something else. So she was on morphine the day of surgery, and I believe it was the day after surgery as well. They didn't want to give it to her too often, of course. They told me that she was really only going to be on the very strong pain medication for a day or two. After that, it was only going to be Tylenol. And I was very surprised just because I was like, Camila just got, major surgery done. She's so tiny, and all the machines and the incision, and they have to really break her chest bone open to get to her heart and her pulmonary artery. How is it possible that she's only going to have pain medication for only a few days? I just thought that was really crazy. But, they said if Camila is not handling the pain well with just Tylenol, of course, we'll give her something stronger. But really, we don't see that being the case. I said, okay. And yeah, the second day, May 13th, she had morphine maybe once or twice, and then we just started Tylenol, and she seemed fine. That second day, she was no longer getting any kind of sedative. So that was nice just because she was a little bit more awake. But she was very uncomfortable because she has all these lines in her. She has, her drain tube, her RA lines, her IV in each limb. It was just a lot. Camila was doing really, really well, but because of the RA lines, I wasn't able to hold her. Those RA lines were connected to her heart. They stick out like the bottom of her incision. So they were very, very delicate, and they couldn't be moved. So the nurse was kind of able to hold her a little bit, but not too often, and I wasn't able to hold her at all. And that was hard just because, I just feel so awful for everything she had just gone through, and I just wanted to like hold her and snuggle her and tell let her know like I'm right here. But I had to do that with just holding her hands and talking to her and doing what I can really to be there as much as I could for her when I couldn't hold her. So those RA lines were in there for about 3 days. And when they took them out, we had to get out of the room, and it was just the doctor in the PICU was able to take those out. So they didn't need the surgeon, so that just the PICU doctor took those out. We left the room for like 30 minutes. We came back and they were gone. And they wanted to take the drain tubes out, but because when they took the RA lines out, Camila, more fluid was coming out of the drain tube. So they said, you know what, let's just keep the drain tube for another day. We want to make sure that there's no excess fluid. But when those RA lines did come out, we were able to hold her. So I was very happy to just be able to hold her. And she just started looking a little bit more like herself. She wasn't as swollen. That first day, she was very, very puffy. Her eyes were very, very puffy. Her arms, her fingers, toes, everything. So she started looking a little bit more like my baby, like Camila. Along with the swelling going down, a lot of the machines started coming off. She no longer needed to be hooked up to so many machines. Slowly, like one IV would come out of her leg, maybe the next day another one. And just slowly I noticed there wasn't as many machines in the room. She wasn't continuously connected to oxygen the entire time anymore, just kind of when as needed. So about on the 4th day, I would say, Camila's drain tube came out that afternoon, and it was just such a relief just to finally have that out, because it was just, there wasn't anything on her chest anymore. There was just the incision, but there was, you know, we could wrap her up and put a, you know, a shirt or a onesie on her, and it was just, it was a relief just to see that there wasn't a tube coming out of my daughter's chest. And it sounds very blunt of me to say it that way, but that's really how it felt. So it was just a big sense of like, I could breathe, and it felt like just relief once that was gone. So Camila was on oxygen on and off depending on her oxygen levels. So part of this band that Camila got was her oxygen levels were going to be lower than normal. Camila's oxygen levels were going to be about in the 80s, and that could sound very alarming at first. And I had a lot of questions when I was first told that. And I knew before the surgery that's where her oxygen levels were going to be, but it was just not really normal to hear. I remember telling my parents, and my mom was just very surprised to hear that. I think I even told her pediatrician. She was just like, oh, okay. I think she even spoke to the cardiologist just to kind of get a better understanding of why. And I did express my concerns to her cardiologist, and she said, he told me like that it's very normal for a heart baby like Camila to have her oxygen levels lower. It's not normal for just a regular baby without those complications, but for Camila it is. She's going to be fine. Her normal range is going to be within the 80s, and she won't need extra oxygen. So it was a little weird, but that's Camila's normal. The surgeon every day was, during rounds, was coming in and checking up on Camila. Camila's cardiologist was checking up on Camila every day. The PICU doctors were always going, you know, into the rooms and checking up on us. There's one specific doctor that I appreciated so much, and he was just very like patient oriented. Like he very much wanted to always know, like, if there's any questions, don't feel like you can't ask them. He told me once, like, he's not the doctor that's going to be waiting for a patient to need him. He wants to always be there for the patient and try to anticipate the needs that they'll before they need them. And I just really liked him. He was definitely a doctor I felt very comfortable with, and I trusted very much right away. The doctors were also very pleased with how quickly Camila was recovering from the heart surgery. I believe it was like 5-6 days after surgery, her surgeon told me, like, heart-wise, Camila is doing very well. She was basically cleared by the cardiologist to go home as long as everything else was okay. That just wasn't the case though. While we were in the pediatric intensive care unit, Camila's feeding started to go down. Camila had been on Similac sensitive and breast milk, but she was having a lot of tummy issues. She was having tummy issues before the surgery, and after the surgery, they just seemed to have gotten worse. Camila was not giving us a dirty diaper. Camila was straining herself to pass gas. Camila was not even eating 2 ounces. And that was very alarming. Camila was losing weight at this point, and we expect Camila to lose weight because of surgery, but it was just happening too fast. Camila also started throwing up any milk she was taking. So really she wasn't keeping a lot in her system. And that was very scary because you're telling me her heart is doing so good, but Camila's not wanting to eat. If Camila wasn't able to keep food down and continue to lose weight, they were going to have to insert a tube through her nose to feed. And that was just not something I wanted to do. The doctors told me, you know, it would be okay if she did. We want to make sure she's getting enough calories in. But it was just very scary for me to think about her getting a tube in to eat and to be able to continue to grow and gain weight. So we really, really had to push for Camila to eat. While we were there at the PICU, I was bringing in my breast milk. I was pumping in the PICU. I was pumping at home. I was bringing whatever milk I could but I was just not producing very much. They did switch Camila's formula from Similac Sensitive to Enfamil Gentilese, and they did that for a day or two, along with the breast milk that I was able to give, but her stomach issues still hadn't resolved. They started giving her Miralax and said, you know, let's just give the Gentilese a few more days, and if it doesn't work, we'll try something else. The Miralax did help with her going to the bathroom, but still not as much as we wanted to. So another thing the doctors were telling me, that the strong pain medications do constipate, but it was getting a little bit out of hand. I mean, Camila had gone like 4 days without a dirty diaper. She was giving wet diapers, but not dirty diapers. And she was in pain with all the straining she was doing. She was very noticeably uncomfortable. She started not wanting to eat because her tummy was just not handling it well. So at that point, the doctors changed her formula again, and the doctor really had to talk to me and just tell me, you know, we don't know if it's the formula that's giving Camila tummy issues, or if it could be something you're eating going into the breast milk, going into Camila. I at that point wasn't producing very much, and I had to really make a decision on, do we figure out if this is a formula problem or a breast milk problem? We just weren't sure. At that point, I made the decision to stick to just formula, because the doctors wanted to know if this was a breast milk problem, we needed to be giving her more breast milk. I wasn't producing anymore. I couldn't magically just give her more. So at that point, I stuck to just giving her formula, and it made me very, very sad, because I mean, I wanted to give her just breast milk. My goal was to take her off of formula and to just do breast milk, and to do that for, you know, the first 9 months, year of life, as long as I could do that. And it just didn't happen, and it made me, of course, very sad, because it was just something, again, that just didn't go my way. And I feel like I keep repeating myself, but there was just everything I wanted kind of wasn't going the way I wanted it to, and the little bit I felt like I had control of, my body wasn't doing naturally. I mean, I tried for weeks, and I'm thinking maybe my milk will drop, maybe my milk will drop, and it just never did. And that was just so frustrating, and I was mad at myself, and I wish there was more that I could do. I mean, I was taking like lactation pills, I was drinking all the things I was recommended to drink, I was trying to eat the things I was told to drink and eat, and it just wasn't happening for me. I was pumping every 2 to 3 hours. I was waking up to pump. I was making my schedule to see Camila around my pumping, and it didn't work. And I felt like I failed a little bit as a mom, but I had to just remind myself that as long as Camila is eating and getting fed, even if that's with formula, then I'm doing my job as mom. She's eating. And I had to remind myself that a lot that first week that she was on just formula. Camila did get switched over to another formula called Elecare. And with the Elecare, she started to do a lot better with it. She started going to the bathroom. I mean, they were still having to give her a laxative to go, but just not as often. She didn't have as much gas. I mean, she passed gas, but she wasn't having too much of a hard time to do it. Before, Camila would drink her bottle, and within a few minutes, she was just getting very uncomfortable, and she wasn't doing that with this formula as much. So we thought it was a win. So we stayed with just the Elecare. Even with the Elecare though, Camila's feedings were still not perfect. I mean, we were still struggling to get her to eat 2 ounces every 3 hours. I mean, that was our goal, and Camila would do really good for one feeding, and the next feeding she barely ate like a fourth of her bottle. So it was very up and down. And it was very frustrating, because I knew if Camila could just eat and gain weight and maintain and continue to gain weight, that Camila could come home. But she wasn't. I mean, she was still not getting the weight that she needed, and that got frustrated. And it was hard not to get frustrated, because I knew this was all we needed to do to go get home, and we couldn't do that one thing. It also made me very anxious and nervous to get the tube put in, because I did not want that. Camila would do really good one day and gain weight and do good a second day, and the doctor tells me she's gonna go home tomorrow. And that makes me so excited and happy. And then it'd be, you know, that third day where we're going home. I told my parents Camila's going home. My brother and sister, Ben had told his parents Camila's coming home. And we get, you know, to the hospital ready to go home, and they tell me, oh, Camila dropped weight, she's not gonna be going home. That was very hard because you get so excited that Camila is finally eating and gaining weight, and you know, she's taking the 2 ounces almost every time, and then you don't go home. And it kept happening. I think it happened for about a week straight. The doctors kept saying she's gonna go home tomorrow, and I get super excited and happy, and she's not. We come to the next day happens, and oh, she's not going home, she didn't eat very well throughout the night, or oh, she didn't gain any weight. It got to the point after like 3 or 4 she's going home tomorrows, I just stopped expecting to go home. We were always ready and prepared to go home, but I never counted on it anymore. As much as I wanted to, it kind of broke me down every time I thought we were going home, and I was almost in tears when they said, never mind, we can't, Camila didn't gain weight, or she had, you know, she didn't eat throughout the night very much, or she hasn't gone to the bathroom again, or just anything like that. And I didn't want to rush her to get her home. I wanted her to go home once she was ready, but when you're told she's gonna go home, and she's not going home, it gets very frustrating. But finally, we got to the 12th day, and we, you know, again, the night before, they told us she's gonna go home. And finally, on that 12th day, you know, I woke up that morning, and I went to the PICU, and I talked to a doctor after rounds, and the nurse, and they tell me Camila's gonna go home today. And I was super excited, but also waiting for us to be packing her up, and the doctors or the nurse tell me, just kidding, she's not going. So it made me very nervous, but we finally were able to go home. There was a lot of talk of Camila having to go home on oxygen or not, and having to monitor her oxygen levels at home, but her oxygen levels stayed pretty consistent in the high 80s, and her surgeon and cardiologist were very pleased with her numbers, so I was happy that Camila didn't have to go home on oxygen. If she did, you know, it would have been okay, and we would have done everything that we needed to, but it just felt nice to have her come home without connected to any machines or having to monitor her oxygen levels too closely. Camila was going to be having a lot of doctor's appointments, not only with her pediatrician, but also with her cardiologist, and they would be checking her oxygen levels constantly. I really like the hospital we go to because they were very good about keeping the pediatrician in the loop of everything going on, and they spoke to the pediatrician about where her oxygen level should be, what to expect, what's going on, and it was nice because yes, I could explain those things, but I know that when a doctor is telling another doctor, they're able to explain exactly what's going on, not just how I interpret what they're telling me. So that was awesome. So we finally went home 12 days after Camila's surgery, and I was just so relieved. And Camila was going to be seeing her cardiologist just a week after surgery and letting us know, you know, how she's doing and what to expect next. But it didn't take too long after being home after surgery for us to end up back in the emergency room. And that's what my next video is going to be about. I hope to guys see you then. Bye!